Thank you very much. So yes, my name is Dr. Ebenezer. I'm here with Paris. We currently run our clinic in Dubai. We are called
London Clinic, Dubai. Yes.
That's right. London Skin Clinic in Jumeirah Beach Hotel. We have actually works that happen in, I think, let me sit facing you. I feel a little bit more comfortable. Is that okay?
Yeah.
Yeah, okay. So we've got works running across Malaysia, Dubai, London. We're trying to help patients achieve optimum wellness, if I can use that correctly. Right?
What will be optimum wellness in this case?
So when I say optimum wellness, basically what I mean is we're all going to grade O. Right?
Yeah, correct.
Our cells have a period of life cycle, right? New cell is formed, it eventually ages, it dies. But how do we prolong that? We prolong that by ensuring that we're healthy. But the term by itself, healthy, it's very different for every individual.
Yeah.
Which is why I say optimum wellness is to ensure that you can age more gracefully, you are the best of your health, and you remain functional for long periods of time.
So here we are also talking about functional health.
That's right. I think the whole goal is to remain functional.
So what are some of the limitations that prevent us from having this sort of functional health that you provide for other people? What are the limitations that prevent some of us from attaining this longevity, this functional health?
I think it's our lifestyle, the environment, and our understanding towards our own health by itself. The current system or the current methodology that we all live in is whereby we do what we want to do, we eat whatever it is that we want to eat, we have very stressful lives, right? And then we wait to see the doctor when we have symptoms. Then you go and see a doctor in a hospital or in most ecosystems that are overcrowded.
Yeah.
And then you get handed medications and you don't take good care of yourself. You continue taking the medications and then you become, you develop complications from these medications of the disease, and then you become dysfunctional at the age of 60, 70, or in some people, if they're not lucky to reach up to 60, 70, they end up with a fatal disease much younger. For example, let's take diabetes. I've seen patients as young as 18, 19 years old developing type 2 diabetes. Type 2 diabetes is essentially diabetes because of insulin resistance, right? And that a lot of time that happens because of our lifestyles, is what we eat, the inability of our body to break down the glucose. And then they do not take care of their health, and they're often also obese. By the time they're in their 20s, they start developing complications from it. For example, chronic kidney disease or requiring dialysis. They have kidney failures, right? So at a very young age, they have to actually sit in a chair and wash their bloods 3 times a week. And what happens from that is the quality of life completely goes. They cannot work, they cannot function. So all they do is they depend on the system to actually help them get some money, and then they go through this dialysis process and they just basically become non-functional.
So when you talk about diabetes, now, some people, they take a lot of sugar, but it looks like it affects more people than the others. So definitely DNA is at play here. The same lifestyle with different people cannot result with the same problems at the same time.
Absolutely.
So what are the early warning signs for a person that you don't understand your DNA, you don't know if you're going to get diabetes in the near future, or should people understand their genome to prevent any chances of diabetes?
Absolutely. I think people should know now what we offer is called an epigenetic study, right? Whereby we look at your genes, we try to understand the different expressions of your genes to understand what is your risk of different disease. Okay.
Yes.
Going back to something as simple as diabetes, where you ask me one person having sugar versus another person, it may not have the same effect. Yes, correct. Genetic plays a huge role. We can see that in terms of obesity, for example. Why is it that some person eat and they fall on weight so easily versus another person? We always say it's metabolism, right? But there definitely is a gene factor that affects metabolism as well. So yes, it goes down to your genes, but in terms of diabetes and sugar, doesn't matter whether it catch you early or it catch you later part in life. It's going to come, right? Sugar causes inflammation. Sugar, I think, is one of the biggest problems that we can have. So whether it's good for you now or bad for you later, right? We should avoid it altogether and try to achieve that healthier lifestyle as much as you can.
Maybe the later means along the line you can actually change your ways? Is it possible?
Of course, but it's always the earlier the better, right? The earlier you make those changes is much beneficial for you.
So from when you started practicing preventative healthcare, how has the industry come to the terms with, and the people as well, come to terms with diabetes? Is there more awareness, more prevention? Are people getting fed up with sugar? What have changed so far?
The role that I'm trying to play is to spread awareness of the disease and the ability to reverse diabetes by itself. A lot of people think if I get diabetes, that's it. I'm going to have to live with this for the rest of my life. I'm going to have to take medication for the rest of my life. And this is something that I have to live with. What I'm telling people is you have a chance to reverse your diabetes. If you make the right lifestyle changes and do what you got to do to help your body process all that glucose, improve your insulin resistance, reduce your dependence on medication, you actually have a chance to reverse diabetes. And many people have done that.
So let's talk about reversing diabetes. How does it work?
Okay, that's a complex question actually.
Yeah.
So
You can break it down to the simplest level.
So the first thing, so even in the clinical practice guidelines that we have, if you have diabetes, the first thing that you're supposed to do is they say lifestyle modification. So how I help my patients achieve diabetes is to define what those lifestyle modifications are, because every individual is different. But the goal is very simple. The goal is to reduce your HbA1c, and HbA1c is the hemoglobin count, your glucose count over a period of 3 months in your body. But I also want to do that by improving your insulin resistance, right? I want to make your cells more insulin sensitive. So how do we do that? We take a couple of strategies. We try to understand how your body acts to different food, what kind of glucose spikes you get. From there, we understand what kind of insulin response your body produces. So we try to alter that so that we can prevent these persistent insulin spikes that eventually causes resistance. So by adjusting those things, we can achieve insulin sensitivity.
So after these processes does the person go to? So you withdraw from sugar, you keep active lifestyle, or?
Absolutely. You try to remove yourself from having too much of sugar. We try to get you into doing more physical activities so that the current sugar that your body already has is being utilized into the muscle, because your sugars are actually stored either as fat or they're stored in your muscle or they're utilized by your muscle, right? So we try to get it into the right parts of your body for utilization.
If you keep an active lifestyle, what are the chances that you're still going to become diabetic in the future? What is the percentage as well? If it's going to reduce your chances or increase your chances anyway?
Okay. There are many people who have an active lifestyle, but they still develop diabetes. Question is why? It's all because of how the body reacts to sugar by itself or glucose, because maybe your body cannot process it as well as somebody else. So it goes back to understanding your body and adjusting the food accordingly. So that goes to a question of diet, right? If you are somebody who exercises,
right,
you definitely have a lower risk of developing diabetes, right? But if you have a particular gene or you have a genetic factor whereby you cannot process glucose as well as other people do, you have overload of insulin in your blood, you're constantly having insulin spike, and you have insulin resistance, then yes, you still have the risk of developing diabetes.
And this process of reversing diabetes, how long does it last for? Let's say you start the process. For each individual, what is the average time for them to fall back to being normal? Do they fall back to being normal even?
It depends on person to person. Some people take 3 months, some of my patients take 6 months. I have someone who's still taking about a year and they haven't completely reduced it. They are about 6.6, 6.7%. So you want to bring it less than 6.5% and you want to try to remove as much medications as we can. It all depends on which stage of diabetes you're in, how chronic the disease has become for you. And then we can see how much we can actually help and reverse the disease by itself.
So it's like a process, then apply this reversal process and then there's a follow-up as time goes on, correct?
Yes. So my program essentially is I teach you about yourself, I teach you how to get through the whole entire system, the day-by-day lifestyle of trying to make those small changes to improve the insulin sensitivity in your body, okay? And then we keep a check and we try to keep pushing it until we achieve the targeted goal and results. But you have to continue keeping to that lifestyle to ensure that you do not develop diabetes again down the road.
So during this process, does the person stop medication?
If I see that your HbA1c has improved and it's safe for me to remove your medication, then I will remove your medication.
So it's not for everybody, and there is a level for that to happen.
It's not for everybody. You cannot stop on your own. I have particular indicators and parameters I monitor, and when I see it's safe, only then I take it out.
Do they usually get some effect, withdrawal effect or something?
No, not at all.
So it's just take it off and they're okay, they're balanced.
They're okay. It's a slow process. We try to understand their body, we slowly take it off, we monitor. Generally, they feel better, there's no withdrawals. The minute you start doing things right, the minute you start removing sugar from your body, you start removing sugar out of your diet, automatically you will start seeing the difference. You're more energetic, you sleep better, you have improved performance in the gym. So your life and your quality of life by itself becomes better.
So what about stress? Does stress add anything to this aspect?
Of course, stress is a huge contributing factor in our life, right?
Right. Yeah.
When you are stressed, different people respond differently. For example, stress eating by itself.
Okay, yes.
Some people, when they're stressed, is when they feel they need to eat more. And stress also is correlated to your sleep, right?
Yes.
If you don't get enough sleep, or if because of stress you don't sleep very well, all this affect your hormone regulation, how your body produces different hormones. The whole cycle gets affected. There are research that shows who eliminate sugar have a better response to managing the stress. There's better energy levels to actually run through their day.
So there's a connection between stress and sugar level.
Yes.
Okay. So the more you eat sugar, the more stressed you get.
No.
Okay.
I'm just saying,
Simplify.
the more sugar you have, the more inflamed your body is. The more inflamed your body is,
Okay.
it's more likely you are unable to process the hormones necessary to break down your cortisol, to break down the stress hormone, to regulate your cycles. So when you don't have the sugar, when you reduce this inflammation that is going on in your body, when you have improved amount of energy, when you have better sleep regulation, right? Everything starts to function better. So that's what I mean. It's a cascade of things.
It's a cask. So it's not just one particular.
No, it's not one particular. It's not like eat less sugar, your stress is going to go down. Because stress has so many different things that can be affecting your stress as well. And that is a whole different rabbit hole by itself.
And all of this contributes to longevity.
That is absolutely yes.
What about calorie restriction? How does it affect this reversal of diabetes? Is it a thing, or there is no connection?
I don't talk about calorie restriction with my patients, especially in the diabetes reversal program. That is not our primary goal, because the goal is to understand what you're eating. I don't want them to fuss about counting calories, as it becomes very difficult, and it also can be very hard to be compliant to doing a calorie deficit diet. Being mindful, I think, is what was more important. Having a proportionate meal, I think that's just much easier to follow. Now, going back to the question of does calorie deficit have any effect in reversing diabetes? Yes, if you have a calorie deficit and through that you actually lose weight, right? Weight loss have shown to be one of the strategies to improve diabetes. So there's a direct correlation to it, if I can answer that simply.
Now, there is a thing. If you are, let's say, you will have the perfect weight, BMI, everything is okay. Is there a possibility that you will still become diabetic?
Yes. There are a lot of people with perfect BMIs,
Yes.
okay, who are still diabetic. And this is why I don't like BMI. I think BMI is really inaccurate, because what is BMI? Essentially, it looks at height, weight, and age. It only correlates between your height and weight. Just because somebody is shorter and bigger doesn't necessarily mean this person is unhealthy compared to somebody who is tall and probably still bigger, but does not correlate in terms of BMI.
Yeah.
Because the end of the day, BMI does not tell you about your visceral fats. Visceral fats are the fats that are deposited in your organs. So there are two types of fat. There are adipose tissue fat, there's visceral fat, okay? Adipose tissue fat is very easy to see. Then you see this person is overweight. Visceral fat is what is the fat that covers your organ and nobody can see. Somebody can be thin and they can have a lot of this visceral fat. And somebody can be thin and they can also process insulin very poorly and they develop insulin resistance. And these people may also have diabetes. Do you get what I'm saying?
Yeah.
So there generally is just no correlation between BMI and whether you'll be diabetic. I don't think it's accurate, so to speak.
Yeah. So you mentioned what you're into epigenetics before. So are there some principles of epigenetic that influence the aging process that promote longevity?
Yes, there are a couple of things in the epigenetics that actually helps in longevity, right? To begin with is to understand, for example, how your body processes different vitamins.
In a simple form, what is epigenetics?
So epigenetics essentially is looking at your genes. It's a study looking into your genes to understand what kind of different gene expressions your body have towards different diseases.
Is this a thing people start getting interested in? I mean, if you understand your gene, probably you know what kind of medication tailored to you, what you react to, probably something you might be not very even effective for you, right?
Yes, you can do that. So in epigenetic testing, there are various different testing. One of the testing that you're asking, for example, is related to how different medications affect your body. So yes, you can actually do that to see what medication is suitable for you. Possible.
It's possible. So is this a common practice now?
No, not really. Not many people know about it. Many people know what to do with that information. The problem here is they always often ask me, why do I want to know something if I don't know what the problem is? Isn't it better for me not to know the problem? And then
ignorance is bliss?
Ignorance is, yes. So it's not widely known, I feel, but what we tell our patients is that if you can catch something early on, if you understand that you have a higher risk of developing this, we can help you do the screening protocol that is necessary to prevent the disease from happening. Catch it on really. Not yet a common practice, but we're pushing for it.
Not yet a common practice, but you're pushing for it. So do you think some days it's going to be like how people do blood work every year?
No, epigenetics, I think, is a once in a lifetime. You do it once and you're done.
So it could become a part of your medical history. So
that's right. I think it's something that should be part of your medical history. Do it once in your lifetime, understand what kind of genes you have, understand what kind of expressions you have, what risk you have, and from there take a proactive approach towards those risks.
So yeah, because I think that if you have your genomes and the history, you could just go to a hospital and this is the first thing they'll probably want to see what kind of medicine is tailored to you.
Yes, but more importantly is for you yourself, because you see the hospitals are not going to have time to screen for everything. But if you understand you have a particular cancer risk or you have a particular disease risk, then you can screen for that particular risk more often. You can push for those screenings to understand and catch it really early on.
Future is exciting, yeah.
Of course.
So functional medicine, what comprises of functional medicine? I feel it takes a holistic approach, yes. So functional medicine takes a holistic approach to healthcare. Can you explain the perspectives that differs from conventional healthcare medicine?
So in functional medicine, essentially what we do is we try to look, like you said, we take a holistic approach at it. We look at a person as a complete individual. We try to understand what your genetics says about you. We try to understand what your lifestyle says about you. For example, your diet, your environment, the stresses, what you work. We look at histories that don't just relate to you, but also your family, the backgrounds that you come from, where you come from. We take detailed history related to your childhood, any exposure that could be causing it. Yes, it's a lot. So essentially, because you see, if you have a particular disease, it may have taken you 30 years to get here. There could be at different points in your life that could have been pivotal to understand what's making you have this particular disease right now. And if we can remove these factors, then it will give us better results in achieving remission. So essentially that's what functional medicine is, to go down deep into the root cause, find out what could be causing this, and then trying to tackle those issues. How is this different from conventional medicine? Conventional medicine, essentially, we look for the problem. We look for the root cause of the problem in terms of the stem of the disease by itself, and we treat that. But I feel that we don't go in much deeper. We sometimes leave it at the point, oh, this is because of genetics, because it runs in the family history. Here you go, start taking medications. We don't look into the genetic side of things. We don't look into the lifestyle side of things. I think it's a very important elements that functional medicine assists us to actually achieve those data and to help our patients.
Functional medicine and gut health, is there a connection?
Functional medicine is an approach that can be used across all boards and all different systems. Gut health by itself, in terms of, so you're asking me, how does gut health, or what do people do with functional medicine?
Yeah.
Okay, let me say this. Functional medicine, I personally don't think it's a branch of medicine by itself. It's an understanding
So I understand that.
of how doctors practice medicine, and different practitioners do it very differently.
Okay. So there is no universal standard. Is there?
There are certain standards. I just won't say it's universal just yet.
Okay,
It's still a developing
There-
field. People
okay.
are still trying to give their guidelines. A lot of people call themselves functional medicine practitioner. To me, what does that mean?
What does that mean?
What does that mean? Can you just take a course online and call it a functional medicine practitioner? I think functional medicine practitioners are practitioners who really try to understand a particular subject very well, and they work on themselves to improve their knowledge on that particular subject and help their patient. So no one person is going to be able to know everything. So I think when somebody uses that word, I'm a functional medicine practitioner, the trust that they're trying to give is that I really want to deep dive with you to understand what your problem and disease is. So let's go back to gut health. When you say gut
Yeah.
health, in terms of gut health, a lot of us functional medicine practitioners, what we do is we use a series of tests, which often are very expensive,
Right.
to understand what's happening in your gut.
So can you
And-
name an example of test?
The common test is your GI map,
What is
right?
this?
Which is your microbiome assay. Is to look at the microbiome in your gut to understand the kind of good and bad bacteria that is sitting in your gut. Because there is a huge correlation between different diseases and the level or the status of your microbiome.
Okay.
One of the studies that we do, we call GI maps or GI effects. We essentially look at the rate of inflammation that's going on in your gut, the different types of microbiome that's happening in your gut. Is there any evidence of dysbiosis or patterns where there is an imbalance? And that gives us a picture of what we can fix, especially in these good and bad bacteria, as I said.
Okay. That looks more personalized.
It is personalized.
Yeah, it looks more. And where does functional medicine come into play with mental and emotional well-being?
Tough question. How emotional well-being is part of a complex ecosystem of a human. Now, there has been a study to show that there is a connection between the gut and your brain. We call it the gut-brain axis, right?
Mhm.
So when you have poor gut health, right, there is evidence to show that it actually affects the way your body produces the different hormones and the way it actually functions. Sorry, I'm actually lost in thought. So you wanted to understand about functional medicine and gut health.
The functional medicine, how it solves the problem of mental health and emotional well-being.
Whether or not it solves, I can't tell you that. What I can tell you is, for example, if I understand that you're stress eating and I understand what causes you to stress eat, right? And if there's any correlation, for example, the deficiencies in your gut, then fixing these different components help me achieve better results. Let's go back to functional health and mental health. Mental health is a component that we need to look into. We need to understand if there is a part of that is causing you to have the symptoms that you have or the way you behave. Are we able to alter that behavioral pattern?
Yeah.
Stress eating. If you eat because you're stressed, okay, then that by itself I know is activator. And if I can fix that stressor, if I can fix that behavioral problem, I may be able to cut down on a couple of things. Do you get what I'm saying?
Yeah.
So I use that as a component to help fix the problem of obesity. If obesity is where you came from and the stressor is basically because of stress eating. But the middle ground, the thing to understand here is where we say gut health.
Yeah.
Right? So to understand gut health, to understand how good or how bad your microbiome is, perhaps you may have some other symptoms related to it, bloating and other things. Then we can look into your gut health and see what are the things that we can fix to help all of this. Some people also tell us, for example, I stress eat and I feel funny in my stomach, I feel hungry, I have all this juice that comes out, and if I don't eat, I feel pain. So I need to eat. So that is the activation of your hydrochloric acid when you're stressed. So understanding all these different factors then gives us a way to give you a plan on how I can help you, set you on a journey to reverse the disease or the problem that you have.
Cool. This is great. So
I hope I'm not confusing everybody.
Have you come across a situation where the same approach will work for different people from different backgrounds? Is this often a thing?
I think everybody's different. It's very hard to give the same approach for everyone. Generally, I have frameworks that I built for different issues, but it has to be tailor-made to each individual.
So in your opinion, what is the future of preventative medicine?
I think at the present time, the future of preventive medicine is the ability for us to screen for diseases before it actually takes place. There are more and more people who are offering more active screening protocols.
How can you screen for something that is not there yet?
There are precursors. Like cancer, for example, the current tumor markers that we have essentially looks for elevation that already happens right now. But there is a test where we call a CTC test, a circulating tumor marker. It looks for cancer cells even before your tumor markers get active. Like, for example, you go for colonoscopy and you look for polyps that occur, and until you do biopsy in those polyps, you don't know if those are cancerous, right? You go looking for it. So there are more and more non-invasive tests to actually look for these problems early on.
Apart from oncology, is there other parts where this sort of preventative screening is going on that you're aware of?
Yes. For example, when you talk about insulin, screening for fasting insulin, all right, coupled together with other metabolic markers and even doing things like C-peptide, actually can give you an idea of the risk this person has of developing diabetes down the road, the risk of this person having insulin resistance. So we have, for example, the gold standard right now is to look for HbA1c and to look for fasting blood sugar. This could be in the normal range, but if you have high and elevated serum insulin, I know that if this stays the way it is, in a couple of months or in a couple of years, you may develop you may develop diabetes. So once I fix that, essentially you can prevent yourself from getting diabetes.
Are people aware of this?
I don't think so.
So why? This looks like it could benefit everybody, right?
Absolutely.
And it could benefit the healthcare system as well. But why is this not a thing?
Honestly speaking, I don't know. I don't know why we're not pushing more for this information to be out there. Is this a conspiracy theory because pharma companies want to sell you more medication? Or is it because we are lazy that we don't want to go out there and find this information? I don't know, to be honest with you.
I think that the good thing I like about this is that you don't know and you accept the fact that you don't know.
Yeah. I consistently fight myself to ask, why are we not pushing this out there even more? Why are there not more people speaking about it? The message is also very blurred. You have too many people going out there and telling you so many different things. There is a constant struggle between the educated healthcare workers and non-healthcare workers who are also giving information. So there is a flood of message out there and people are not sure which is right and which is not.
Do you think conventional medicine and preventative medicine can work together?
Absolutely. That's what I do. My main practice is still conventional medicine. I use the methodologies of functional medicine just to dive deeper, to understand better. Just because I practice functional medicine doesn't mean I stop giving medications. I still do prescribe medications. But
when they're needed?
When it's needed. As long as I have a chance to work with my patient to help them reverse their disease, as long as I can modify their lifestyle, fix the deficiencies in other things that they have and achieve the same results, then why do I not do that? I'll do that first. So essentially, actually, conventional medicine should work along functional medicine to help patients reverse their disease, get them into remission, improve their quality of life.
That's great. And when we talk about reducing medication and preventative healthcare, where does vitamins come in?
Supplements,
vitamins.
See, the thing is, without realizing, many people are deficient in many of the different vitamins. Vitamin D, for example. If I was to screen 10 people in Dubai, 15 of them are definitely deficient in vitamin D. And
that's ironic considering we have abundance of sunshine.
We have abundant sunshine, we are in the Middle East, but everybody is deficient. My theory is that perhaps because of the clothing that we wear, the sunscreen that we use, it is preventing our body from absorbing the sun. Now, vitamin D is an important immunoregulator. It's got a very important function in our body. And fixing that is very important. We see people have improved quality of sleep, improved moods, improved energy by just fixing your vitamin D. Your vitamin D has its own functions across different systems in the body. But how do we know what to give you? Unless somebody gets screened or do a test for vitamin D, you don't know. Same thing, it goes for vitamin B12, B6, B9, your vitamin K, vitamin E, all the different vitamins. Unless you look for it, you don't know. People do, they understand that you need multivitamins. They go to the pharmacy, they buy vitamins, they just keep popping these capsules. But you may not be targeting the problem that you have. Different people have different requirements and needs.
Yeah, what happens when you surpass the daily requirement of any vitamins?
Your body is actually quite smart. When you have excessive amount of vitamins, what you will most likely do is you will beat it out. You will actually excrete it out of its body. Unless you are persistently taking excessive amounts and it retains in your body, then yes, that's going to cause danger.
So vitamins versus taking the traditional way between fruits, vegetables, abundant, and like oranges, mandarin, whatever, full of vitamin C. What does vitamin C supplement got to do again?
Okay, so let's just say you're vitamin D deficient, right? But your gut health is not very good. Yes, you can have all the citrus in the world. It's not going to be able to fix that.
Why is
It's not
that?
going to be able to absorb the nutrient.
Okay, the absorption.
The absorption of the nutrients is going to be affected, most likely because your gut is not very good. The ability for it to get the vitamin C off the food and process it and release that amount of vitamin D is not going to be very good. So it's still better to take supplement to fix it. You will get from your food, I'm not saying you won't, but if you're already deficient, then probably something else is malfunctioning that we need to fix.
I should take my vitamins then.
You should get it checked first before you take it.
Okay,
and
yeah, get it
understand
checked
what you
first.
need. Yeah.
Understanding what I need.
Yeah.
Yes. Testosterone. Now, I don't have a lot of questions or even a single question about this, but it would be nice to learn about this, how it shapes our lifestyle, our relationships in general.
Testosterone. I think you're talking about the question, what most people ask is about testosterone replacement therapy. Studies have shown that men above the age of 35 onwards, they start having declining amounts of testosterone. What does this do to your body? Of course, number one, main thing it starts affecting is your libido. It starts affecting your sex life. But it can also cause things like erectile dysfunction. Lower amounts of testosterone can also result in poor energy. It affects general men's health. And it also causes aging, right? Men with lower testosterone are seen to age much, much faster because testosterone is actually a protective hormone for men in our body, right? So it's important to actually screen and see what are your testosterone levels. If your testosterone levels are on the lower side, it will be beneficial to some men to actually replace them to be at a healthier level. Testosterone at the age of 20 is approximately about 700, okay? As we age, as we pass 35 and above, it starts halving. It's probably 350, 200. Some people have it even less than 150. And at 150, it cannot function the way it should. And when we supplement this, okay, it actually gives back the quality of life to this man. And I think that's very important.
Is there a way to prevent this from having?
No.
There is no lifestyle to prevent this from having?
Lifestyle-wise, exercising is very beneficial. Having regular exercise actually promotes natural amount of testosterone. Eating good food, having a clean diet can also help promote good testosterone level. Sometimes you cannot run away from it. It's just the way your body ages, it produces less and less as it ages.
So would you say a man is at 40 and he still has testosterone that is above 500? Is this abnormal?
No. If he's around 40 and his testosterone is above 500, fine. It depends if he has symptoms or not. If he's asymptomatic and he's healthy, then I wouldn't disturb him. I'll let him go. But if he's above 40, he's 150, he tells me, Doc, I'm having poor erections, my sex life is not great, my wife is complete, I feel very tired, I feel lethargic. Someone told me if I go to the gym, I should be feeling better. I hit the gym, I'm not doing great, I cannot build my muscle, everything is going downhill for me. And then they also sometimes have anxiety or depression. The only thing I need to fix is the testosterone. Once I bump those testosterone up, we improve this level of testosterone, you see they're able to get back to their normal functionality.
So when you say bump, is this a continuous process?
Yes, it's a continuous process.
So you bump, like how, on average, how many times do you have to bump in a year?
No, when I say bump the level up.
Yeah,
push
bump the
level up.
what up?
It depends on the different methodology that we're using, whether we give you injections or whether we give you creams or whether we give you pellets. We try to give you continuous support in terms of your testosterone against all the different hormones to make sure that you maintain a healthy level across. You know,
It's not like when you bump it, it's gonna go down again and no?
no. I mean, bump is when we push it up, we try to maintain it at a healthy level, at a stable level. If we give you any medications that we feel is going too high, then we probably have to adjust the dose. We titrate it until we reach the optimum, and then we keep to it.
Oh, okay.
All right. So telomeres is basically the end tail of your chromosomes, your DNA, right? And essentially what happens is as you age, the telomere starts to shorten. So it's actually a key index or a key parameter that tells me at what rate your cells are aging. So we look at your biological age through your telomeres. So that is basically what telomeres are. There are different means and methods that we can try to change your lifestyle, or what commonly they use as biohacking protocols,
Right.
to actually help improve the length of your telomeres so that we can slow down aging through different means. I don't think it's a common thing, not many people know about it. It's not mainstream, right? In Dubai, yes, many people are trying to push for it, trying to achieve it, trying to test for it. We have tests where we can measure your telomeres. It's still costly at the moment because there are very few labs in the world that actually measures your telomeres. And like I said, it's very similar to a genetic test. So we do a saliva sample, we send it out to the labs, then they will ask you a series of questions and they measure your telomeres and tell us what is your actual biological age. And then we will try different protocols to help you achieve elongating the telomeres and to reduce your biological age. Rate of it aging, basically.
Are there labs in Dubai that can do this as well?
No, they're all external labs. I can't tell you where because that's our trade secret,
Yeah.
but they are not in Dubai. We send them overseas.
So when you send them overseas to do this, and then that must be really expensive.
Yeah, it depends. It ranges from 3,000 dirhams all the way up to 6,000 dirhams on the labs that we use and the information that they give us.
This is not like it's very expensive, it's just the laboratory, right?
Yeah. It depends, right? For some people, just to find out that one information, it can be expensive. If you ask me, it's vital. It's not expensive. It's an investment into your own health. If I understand, if, for example, if I'm 40 years old right now, but my body is aging at 56, that's not good, innit? You want to fix that. So I think that information is very useful. And for, say, 3,000 or to up to 6,000 dirhams, this information gives me a lot of benefit in fixing what I need to fix.
So what are the future of preventative healthcare and the way it's going? Do you think in the future we're going to have heavier people?
When you say heavier, you mean?
Heavier people than
Healthier,
now?
okay.
Yeah, healthier.
I think a lot of people post-COVID are more and more receptive towards their own health. They actually want to make a change. So yes, I think at the rate we are going, and especially what I see in Dubai, I do really believe that we will have healthier people. People are making active choices to make a difference, and that's great. And there are more and more practitioners, there are more and more doctors out there who is pushing for a more holistic approach to actually change all the different components of your life, to incorporate wellness, mindfulness, to achieve a more sustainable change. So I think yes, we will have healthier people down the road, and we have more and more key indicators to actually show us this information.
So what made you to set up in Dubai in the first place?
I like the mindset. I like the mindset of the people that is here.
When you say the mindset, give 2 examples.
So, I think people who come to Dubai are a very different group of people who live the comforts of their home, live the easy things of life to come and achieve the dream, the wealth. Everybody spoke about the American dream. I think in today's time, it's the Dubai dream, right? Anything and everything is possible in Dubai. Now, these people also understand that they need to work very hard, very long hours to achieve those goals. And that comes at a cost. It comes at a cost of their health.
Stress.
Stress. It is a very stressful city. It's
Of course.
very, very expensive. We have beautiful beaches, okay? We have beautiful people. We live in a perfect melting pot, but it's very stressful. Having that said, okay, in Dubai, many of these people are actively willing to try new things to improve their health, to push for the wellness. There are many communities that actually do different things together. You have communities that goes ice dipping together. You have communities that goes gym together. You have communities that goes and climb all the different mountains from here all the way up to Oman together, right? And these communities try to stay sane by continuously doing these different activities together, because with stress, this city can also be a very lonely city. It's very hard for people to find partnership or friendship. And I see that they have built these small communities among themselves to help them continue doing these things, which is very good. You see them pushing themselves to be the better version of themselves. So I like that mindset. I like the mentality. I like people who actually want to make a difference in their life. And I find that working with them helps me understand people better and gives me the opportunity to help more people outside the country. And because I work with a huge melting pot, we have about 189. Recently, I got a new number of 200 different nationals. I get to work with different people, understand the different needs, the different backgrounds, so I can curate and tailor more different personalized approach for people from around the world. So I'm not confined to working with just a group of people or with a group of nationalities. I get to work with a variety.
And how has this affected your experience so far, this diversity of people? I'm sure you see different stuff that sometimes wow you, because you deal with different people from different genomes, different race, different background.
I think the background itself it's a huge advantage to me. It's given me a whole different experience that I really treasure. For example, we do food intolerance. I was talking to him about milk, and I was talking to him about lactose-free milk. And then he told me, Doc, lactose-free milk is not milk. Any milk that has been modified is not milk. It's a drink. It's just a form of a drink. Mm-hmm. So he was telling me how in Switzerland, apparently, and I'm not sure how true this is, I've not validated the fact, but he told me, anything that has been modified from milk is not a milk product. It's called a drink.
Or a cream.
So it's very interesting to learn from these different individuals how they take into perspective of things, their background and their cultural differences, and how they attain to that lifestyle, and how I can help them to help improve or attain optimum wellness through their cultural backgrounds. So I think that's interesting.
That's great. And where do you see this trend going for you? Currently, you are here at the Jumeirah Beach Hotel.
So we are in the midst of expansion. We are looking to open more clinics in Dubai. We are also, so I'm running a program. We are doing this internationally. I'm primarily focusing my program on helping people reverse diabetes. Because of this experience with different nationalities, their cultural backgrounds, it gives me an edge to understand how I can help my patients outside of Dubai in different parts of the world to understand the backgrounds they come from, what may be most suitable for them, and how I can tailor make these programs just for them.
You mentioned that you don't know, earlier you mentioned that you don't know how some of this information is not out there for a lot of people.
I'm trying to create a community. I'm trying to create a community of people that I can help them reverse their diabetes, help them understand better about the disease. And I want to create leaders to go out there and continue doing this change with other people. I want to create a community that spreads this awareness, not just doctors, but even patients themselves, to go and give that information out based on the changes that they have experienced themselves. I want to help empower these individuals so that they can go and empower other individuals and change their life. Because I don't think I can do this alone. It has to be a community work.
Now, have you started?
Yes, we have.
How is it going?
It's going fantastic. Of course, currently I primarily am working with my patients in Dubai. I've opened a batch of cohort in Malaysia for my Malaysian patients to join. So we are in the midst of our first group where we're training them, we're grooming them, we're trying to help them reverse their diabetes. We've got quite a few successful patients. We managed to bring them the HbA1cs within 3 months, and we'll continue to work with them. We'll continue to build our program so that we can be ready to take on different parts of the world.
Secondly, this region is on the higher side when it comes to diabetes.
That's right.
what do you think is the primary factor?
Food. Food. Very easy. Food. Food. Malaysia is among the Pacific region, the Southeast region we have the highest amount of diabetic patients. We have some of the most obese patients in that region. Why? Is because of food. We love to eat. It's in our culture to eat, and we can eat all the time. We have restaurants that run 24 hours a day, and I love these restaurants. No disrespect to them. It's amazing. It's so easy. People come to Dubai and they say, oh, Dubai is so easy because I can order talabat and they deliver to me. I'm like, guys, what are you talking about? I've seen this since I was born. If I want food at 3 a.m. in the morning, I can find food. It's not a problem in our Asian countries, right? But that is the biggest disaster of the century in our health. Because we have constant access to food, right? We don't know when to stop eating. And we continuously eat, we continuously spike our insulin, and we give ourselves the gift of insulin resistance, eventually leads to diabetes. So, one simple approach is restricting. Understanding when to eat and when not to eat, doing those changes, that by itself helps a lot. Yes. When to eat, what to eat, and where to eat. These 3 questions is what you need to define. When to eat, best that you have a restrictive eating period. You eat at a fixed period of time. You put in goals of intermittent fasting, for example. Depends on different individuals. Eat only during the certain period of time and let your body have a good amount of fast period. Because it is shown, there's a lot of studies to show that this intermittent fasting diet is very anti-inflammatory, right? It's very beneficial in terms of reducing your insulin resistance. So restrictive diet is beneficial. Time restricted diet. Second is what to eat. Understanding how different food affects your glucose spikes, affects your body, having tools and data to improve that number will help you reverse diabetes. Third is, I already spoke about when to eat, what to eat, where to eat. Don't eat fast food. Right? Stop eating all your ultra fast food, and it's best to eat from home, to cook your own meals. But not everybody can do that, right? A guy who's riding and delivering foods is not probably going to be able to cook all the time. People who work late nights in the bank, who are doing customer service, who actually answer phone calls in the bank, may not be
this
able
where
to
stress
cook.
comes in with
This is where stress
habits.
comes in. I think it's unfair for me to just say all of you should cook at home and eat, or all of you should go to that restaurant and eat, because I know they're going to tell me, Doc, it's so expensive to eat out in the healthy restaurant, right?
Yeah.
So there are ways we can actually get cheap food even from the stores and make easy things, or we just need to understand which restaurants or which kind of food will benefit us. So that is, I think, the answer to where to eat. I'm a Malaysian. I studied in Russia. I spent 6 years in Russia. I did my medicine there. I went back to Malaysia after that. I worked in internal medicine. I worked in a hospital called Kuala Lumpur. Initially, I did my training in Malacca. Then I went to Kuala Lumpur. In Kuala Lumpur, we worked with essentially helping patients with things like diabetes, your cholesterol problems, or I worked also in cardiology. So, we took care of patients with heart attacks. I did a long period of time in gastroenterology. So we did a lot of all your diseases related to your gut, your stomach, and also your liver, your gallbladder, understanding all these different diseases. So I work primarily with chronic diseases, which is why I eventually dive into functional medicine to help understand deeper root causes and trying to fix them.
What is the most thing you learn from working with chronic diseases?
It is let me rephrase this. You are what you eat, okay? And whatever disease that has developed today is because of what you have done prior to that in your lifetime. If you develop diabetes at 33 years old, it's because of how you live for the last 33 is what's given you diabetes today. So don't expect to reverse diabetes or to change that in 3 months. It's not going to happen. Treating chronic diseases, reversing chronic diseases takes time. It's a journey, it's not a sprint. So you need to make sustainable changes, small sustainable changes to achieve.
That has been very eye-opening, and I want to say a big thank you for coming to the Parasurgery podcast. And
thank you very much.
Hopefully we can do more and see how this community is growing and the future of preventative healthcare and functional medicine and functional health as well. Nice to have you.
Thank you. Thank you so much, Paris. It's really, truly a pleasure to be here today.